Hello everybody, Dr. John Dahlman, chiropractor, and today's topic is tight hip flexors and how they can create or contribute to low back pain. Now your hip flexors are muscles that come from your thigh bone, they go up through your pelvis, and they attach at the lumbar vertebrae bodies. And when they contract, they raise your leg. Just like when you're walking, you're contracting them. When you're running, you're contracting them. When you're going up and down stairs, you're contracting them. You're shortening them up. So the problem with hip flexors is that when they get overused or abused, they stay tight in a contracted state. And then they pull hard on the lumbar spine, the lumbar vertebrae. And they create that pattern we've already discussed called subluxation pattern. Subluxation is a vertebral misalignment or dysfunction that is decreasing the nerve or energy flow from the spine. And when your hip flexors are contracted and tight, they decrease that motion of your lumbar spine. That starts to cause swelling on these little nerves right here. That then causes nerve pressure, and you get sub, which is below, lux energy, below normal energy coming out of your nervous system and out of your spine. Now, one of the things that we see is a lot of tight hip flexors in people who sit a lot. So if you have a desk job, you're going to be in a contracted position. Your pelvis is going to be rotated up, and your hip flexors are going to be shortened. And when you have chronic shortened hip flexors, they will cause low back pain over time. And we just can do a simple muscle stretch to lengthen them back out, but we have to do it multiple times. You can't just stretch a hip flexor once and expect everything to be perfect. It takes many, many days to lengthen that tissue back out because you've been chronically shortening it for many days. So we start a program of stretching your hip flexors out, and what we want you to do is to do a lunge stretch. And many of you know what a lunge stretch looks like. You would bend your knee, prop your leg up on a chair or on a can, or you can even be on the ground, kneeling on one knee, propping your leg up like this. What you want to do is you want to pull your belly button in. You want to tuck your pelvis down under. In other words, we don't want to be like this. We want to be straight, pushing our hips down, and then we want to lean forward into the hip flexor. And you'll feel the pull on the inside of your leg here. So when we do a hip flexor stretch, we're looking at doing these stretches for 30 seconds each leg. Do it a couple times. Wait and do it again in the afternoon, maybe again in the evening. And if you repeat this stretch day after day after day, after about 3 weeks, you'll have longer hip flexors and it won't pull so abnormally on the lumbar spine. So people come in and they get spinal adjustments, and they don't do the stretches that we recommend, and the spinal adjustment helps, but then they go back and they recreate the same problem that they've been trying to correct by not stretching them out. So if you combine chiropractic spinal adjustments with hip flexor stretches, then you'll get a longer lasting adjustment. Thank you and have a great day.